Good afternoon, everyone, and welcome to today's webinar, How to Have Crucial Conversations About the COVID-19 Vaccine. Today is Monday, August 2nd, and we welcome you to the next 45 minutes of important updates, and we'll move on to our next slide and tell you more. First and foremost, we want to remind you as attendees that your lines are automatically muted. And you can access today's slides in the chat. So if you notice you have a chat feature, if you click on that, you can find the slides in the chat, and the webinar is also being recorded and will be available on easyIZ.org/COVID/30conversations. Please use the questions pane throughout the next 45 minutes to ask a question. And if you're having any webinar troubles, please email Rachel Jacobs at rachel.jacobs@cdph.ca.gov. Next slide, please. And this is the Q&A panel. So we are not having, as you can see, the green hand is crossed out. You'll see that icon with the questions. Submit your questions via GoToWebinar questions pane and ask staff a question. Next slide, please. Our objectives today are to provide you, the attendees, with the latest updates on COVID-19 vaccination, key messages addressing common patient concerns about the COVID-19 vaccine, and communication tools for effective patient conversations. Next slide, please. So our agenda today, for the next 45 minutes, I will be moderating. My name is Leslie Amani. We will hear from Dr. Tomas Aragon on program and vaccination data overview, followed by Dr. Alex McDonald from #ThisIsOurShot, tips and tricks for proactive conversations. Dr. Aragon will close us with 30 conversations in 30 days, and then we will offer resources, some very important polls, and Q&A. Next slide, please. With that, I would like to introduce Dr. Tomas Aragon, and Dr. Aragon, the mic is yours.
Thank you very much, and welcome everybody to this webinar to learn about how to have conversations with your community, with your patients, with your clients on how to encourage vaccination. I know I'm going to be learning a lot, and so I'm really looking forward to the webinar today. This is a really incredibly important topic, especially at this time. Why don't we go ahead? I'm going to do a little bit of overview of COVID data and vaccination data just to get us started. Next slide, please. So as of July 29th, we have over 44 million vaccines have been administered. We have close to 63% of those who are eligible fully vaccinated. 9.5% are partially vaccinated, and currently we're giving close to 70,000 doses per day of our vaccines in California. Next slide. This is especially important right now because of the Delta variant, which is really moving through our community very fast. As of a few days ago, the average case rate per day is up to close to 15 cases per 100,000 per day. That's about 10,000 cases per day. Our test positivity is now up to 6.7. So our cases are going up. And if we go to the next slide, you'll see that our hospitalizations are also going up as well. An important thing to recognize is that right now, the cases among persons who are unvaccinated is much higher compared to the persons who are vaccinated. And that's also true for hospitalizations and also deaths. So the vast majority of people that are getting infected are unvaccinated, and that's also true for hospitalizations and deaths. Next slide. So this slide here just compares our vaccination progress by race and ethnicity. And the key thing to notice on the left-hand side, as you look across from January until here we see close to August 1st, you can see that there really is a disparity in the proportion of persons that have been fully vaccinated. So you'll see, for example, an ethnic group that has done very well has been the Asian group, and you'll see that there, that orange at the top, you'll see how well they've been vaccinated. And when you go down, when you see Latinos and African Americans, you will see a lower proportion. So for example, for African Americans, we have only 42.6, and for Latinos, it's a little bit above that. The graph on the right shows you the same data. The difference is that it also shows you the bar sizes, which is just the proportion of people. So for example, if you look at Latinos, you'll see that they have 48.1% of people who are still unvaccinated. And if you look at white, you see that's 34.3%. And for Asians, you'll see that it's that small bar. It's a very small percentage. So that's the gap that we really have to close. We need to get those populations vaccinated. And we know right now from the hospitalization data that African Americans are being hospitalized. A portion of persons hospitalized are twice the percentage compared to the percentage in the population. So if we were to look at hospitalization cases, you would see about 12% of them being African Americans, which is twice the proportion in the population, which is about 6%. Next slide. Now, the other disparity that we see is also between different geographic parts of California. So if you compare parts of California that are well-resourced, higher income, that's going to be the green bar on the right, and you compare to the communities that were less resourced, lower income, that's going to be what's called quartile 1 on the left. Again, you begin to see this disparity over time, where the higher incomes, well-resourced and parts of California are vaccinated at a much higher percentage. So you see there's 76% are fully vaccinated compared to about 52% in quadrant 1. So quadrant 1, again, is going to be those parts of California that are less resourced, lower income, have a higher proportion of communities of color. We see that they have lower proportions of fully vaccinated. So again, this is where we have a lot of work, continuing work to do to get those communities vaccinated. Next slide. This is just another way of visually seeing this. So the quadrant 1, which is we know that is less vaccinated, you see that primarily in the north, in the Central Valley, in parts of Southern California. And we see the green areas, which are the higher income, or quadrant 4. We see they're mostly along the coast parts of Southern California and in parts of the mid California as well. Next slide. So I mentioned earlier that the unvaccinated have a higher case rate. So here, the case rate here is 20.7 per 100,000 compared to persons who are fully vaccinated, which is 3.5 per 100,000. So you see this big discrepancy. An important thing to recognize, hang on one second. Sorry, I'm just turning off my cell phone here. An important thing to recognize is that of the persons who are fully vaccinated, their rates are going up because Delta is moving through the whole population. The big difference is that even those that are fully vaccinated and become infected, they are very well protected against hospitalization and deaths. So while we see infections going up among everybody, it's going up much higher in those that are unvaccinated, and the hospitalizations and deaths are concentrated in those who are unvaccinated. So if you look back from January 2021 until moving forward, you will see that the vast majority of cases are in unvaccinated. The vast majority of hospitalizations and deaths are in unvaccinated as well. And so this is really why it's important for us to get folks vaccinated, not just to prevent them from being severely ill and dying, but unvaccinated people are the primary drivers of infection because they're more likely to get infected and to pass it on. So it's very important for us. And so I'm going to go ahead and pass it back to our moderator so that we can continue and get into the key part of the webinar. Thank you.
Thank you, Dr. Aragon. We appreciate that. And as a reminder to our attendees, in the chat box, you can find the slide link and you can follow along during the webinar. It is located in the chat. And if you have questions, please do use the Q&A, that questions pane, and we'll move right on to our next presenter. And we are excited to have join us today Dr. Alex McDonald to talk about how to effectively communicate about COVID-19 vaccines. Dr. McDonald?
Thank you so much for having me. It's such an honor to be here to be able to chat with all of you today. I just have to say, initially this has been a huge effort and it's really, really exciting. So thank you so much. And we have work yet to do, but let's keep going. So I'm Alex McDonald. I am a family medicine and sports medicine physician here at Kaiser Permanente in Fontana, and I'm really, really excited and honored to be able to represent a whole group of individuals from hashtag This Is Our Shot and hashtag Vacunate Ya, our Spanish-speaking sister program. Next slide, please. So This Is Our Shot's mission is to really elevate the voice of healthcare heroes to really build vaccine confidence. We are a group of physicians, mostly younger physicians who started here in California, but our movement has actually spread throughout the nation. Dr. Atul Nagasi, who works at in LA at the Department of Public Health there as well, Dr. Chan from Orange County, Dr. Yap, who's a resident at UCLA, Dr. Sanchez, Dr. Shapiro, who's with Ultimed. There is a whole group of physicians who have been helping really lead this charge, and we basically need you. It's not about me telling your patients, it's about you telling your patients and your friends and your colleagues to get vaccinated. That's really the goal here. We want to give you the tools and the capacity to use your voice and whatever community, be it online, be it in person, to really build vaccine confidence. At this point, over 25,000 individuals have used the hashtag This Is Our Shot on social media. We've garnered over 750 million total impressions across our grassroots campaigns nationwide. Next slide, please. So again, the problem right now is that 37.2% of Californians remain unvaccinated. I saw a recent study showing that 80% of people who have not been vaccinated at this point really have no plans to and no intention to. And really, you are the solution. You are the most trusted messenger for your patients and for your communities. The Kaiser Family Foundation did this poll back in the fall, looking across age, demographics, race, ethnicity, political preference. Basically, your physician, your own individual doctor, nurse, or healthcare provider is the most trusted source of information when it comes to the COVID vaccine. So 80% of the time, they're going to turn to you, not me, but to you. So this is really our call to action today. Next slide, please. Don Berwick has done a lot of amazing work within public health, but I think this quote is probably more applicable today than it has ever been before. The work of a physician as a healer cannot stop at the door of an office, the threshold of an operating room, or the front gate of a hospital. Professional silence in the face of social injustice is wrong, or in this case, unvaccinated or misinformation about the vaccine. Either engage or assist the harm. There is no third choice. And that's really why you're all here today, to really give yourself the tools so that we can have these critical conversations. Next slide, please. So when a lot of the information we're going to present right now comes from a variety of different sources, and we took this information and we sort of paired it and nuanced it to sort of what I think is most applicable to other physicians and other healthcare heroes. So when you look at someone's hierarchy of information needs when it comes to the COVID vaccine specifically, really the number one question is about safety. How will the vaccine affect me? What side effects can I expect? That's usually the number one question. Next hierarchy is efficacy. Does it work? Obviously, we saw that information from Dr. Aragon just moments ago showing it's extremely effective. The next portion is the development process. How is it developed so quickly? And then lastly, access. This is not as much of an issue now as it was 6 months ago. However, there are certainly certain different portions of California, geographic and socioeconomic, who are still struggling with vaccine access to. So these are kind of the four hierarchy of needs that I want you to kind of keep in the back of your brain when you're having these conversations with friends, families, patients, what have you. Next slide, please. Real quick, this is great information from the De Beaumont Foundation. Words matter, and there's certain words which seem to trigger people. So the the left-hand side column there is really words to use, and then the right hand is words to avoid. So use the word vaccination. Don't use injection, don't use shot, despite the name of our hashtag. Don't use jab. I hate the word jab for whatever reason. Use the word vaccine. Talk about vaccines being very safe and effective. Avoid talking about the vaccine was developed quickly, Operation Warp Speed, emergency use authorization. Just talk about authorized by the FDA based on the clinical testing. Talk about getting the latest information. Don't say things are changing. Don't say, we don't know about that or this. Talk about getting the latest information. Focus on safety, particularly family and most vulnerable and your loved ones safe, versus keeping the country safe. For some reason, whatever reason, when they polled individuals and talked about national duty or patriotism, it actually backfired to some degree. And if you talk about keeping your family safe, keeping your grandmother safe, keeping your child safe, that seemed to resonate much more effectively as well. You talk about public health, talk about health and medical experts and doctors. Don't talk about government and scientists for whatever reason. As I'm sure many of you can imagine, those words trigger strong emotions. And then lastly, when you're talking to someone who has questions, again, it's a person who has questions about the vaccine. It's not a skeptical, it's not someone who's vaccine hesitant, although that term is used quite a bit. Don't use the word anti-vaxxer. So talk about people who have questions about the vaccine. Next slide, please. So we have a patient in front of us, or a friend or a family member. And how do we start this conversation? So first of all, I should point out saying when I'm seeing a patient in clinic, I never start with this. I always start with something else. I always build some relationship and build some rapport with the patient first before we talk about the COVID vaccine, because this is a bit of a touchy subject. If you jump right into this one, you don't have that relationship to build on. So, first of all, when you ask about the vaccine, oftentimes when I ask my patients, I already know the answer, but ask and really listen to the answer. Really listen to the answer. Don't just ask the question to then respond. Ask the question to really listen. What do you think about the vaccine? Why do you feel that way? What concerns do you have? People can kind of see through things. If you just immediately respond, you set up this sort of dichotomy and this adversarial relationship very quickly. So ask the question, listen to the answer, and then really create an alignment to hear. I'd really be scared too. I would be worried about losing my job because of lockdowns. I don't like wearing a mask all day. Also, I really can appreciate where you're coming from. So really hearing them and then validating what they're saying and validating their concerns, although some may be harder to validate than others, let's put it that, but reflect back so that they know that you really heard what you're going to say. And then lastly, really focus on that common goal. So yeah, we definitely want to get our kids back to school. Yeah, I want to stop wearing masks as well too. It's so important. But really, what reasons motivate you? What would most motivate you? And this is where the nuance comes in. For as many people out there who have questions about the vaccine, there are as many reasons why they are not vaccinated yet. And we really have to do that hard work to explore what their individual concerns are before we just sort of assume. A lot of times we just sort of think we know the answer based on data, but we have common themes, as we've talked about already, and we'll talk about again. But really finding out what that individual specific question is so important. So really finding their personal motivation. This can take time. It can be problematic sometimes, but really it's the number one thing that you can do at this point to really build vaccine trust. Next slide, please. So now we started the conversation. I'm going to go over sort of 5 key messages based on a variety of information out there from a number of groups that have done this work, Civics Analytic, the Ad Council specifically. We developed these tools and these key messages to really help you know what to say and how to say it. So number one key message, like I said before, safety. The vaccine will keep you safe. The vaccine will protect you from getting very sick. Especially right now, it's important to say the vaccine can't prevent you from getting COVID entirely, especially the Delta variant, but it is extremely effective against severe illness, disease, hospitalization, and death. Over 100, I think it's more like 163 million Americans have been safely vaccinated now, and it will protect you. Next slide, please. Next message, side effects are common. little bit of anticipatory guidance goes a long way. I was talking to a patient a few months ago and said, you know, I definitely recommend you get the vaccine. Here's why. Make sure you get it the day before you have it, before the weekend, or before you have some flexibility in your schedule, because you're going to feel sore arm. You may feel some headaches. You may have some low-grade fevers and feel tired. And I spoke to the same patient again a few weeks ago, and he's like, "Doc, you were so right. How did you know I was going to feel terrible for 24 hours after my vaccine?" So it can go a long way to letting people know, and that way they don't sort of spread that rumor. A lot of patients I've seen said, "Yeah, you know, my friend got the vaccine, they felt terrible." And I then asked, "How long did they feel terrible for?" And he said, "Oh, only a day." And I was like, "That's normal. That's a feature. That's your immune system building up the army." And educating patients about this is really, really important, and knowing that these side effects are actually a good thing, that your immune system is working. Next slide, please. Again, vaccines are very, very effective. Each vaccine is nearly 100% effective at preventing hospitalization and death from COVID, as well as the variants that we know to this date. It'll allow you to get back to things you love and you miss the most. Vaccinated individuals can still get mild COVID infections, but it's very, very, very mild compared to what it would be otherwise. So making sure people know how effective the vaccines are too. Next slide. And then lastly, the vaccine was built on 20 years of research. A lot of people say, you know, it was rushed across the finish line. It wasn't safe. And I often will say, do you remember SARS, the original SARS in 2000? This research and this spike protein research has been going on since then for the past 20 years. And really the only reason in this very big public push across the last stage to get this vaccine finished is really they took all those safety steps, which they normally do sequentially, and they just did them all simultaneously at the same time, and really stressing that no safety steps were skipped. We just got rid of a lot of the bureaucratic processes, unfortunately, that normally present issues. But the point is, this vaccine is built on 20 years of solid research and health experts. Next slide, please. And then lastly, and most importantly, if you have a question, ask me. Make sure you leave the door open. It's so, so important to make sure people know they can come back to you as a resource if they do have questions. Really, I always tell people, you know, the choice is yours. I really want you to get vaccinated, but ultimately the choice is yours. And if you do have questions, talk to me, talk to a healthcare provider. Make sure you get good information and you don't necessarily ask your question out into the interweb, where there's a lot of misinformation out there right now. I think it's so important. And then give them a tool. You know, myturn.ca.gov is what we're using here in the state to find and schedule your free vaccine today. Next slide, please. So really, the three steps kind of after this conversation, really acknowledging their agency and that this is a personal choice. They did a whole lot of market research around what motivates people to get vaccinated, and the two strongest predictors that increase someone's chances of being vaccinated are that it's your own personal choice and that it'll help us get back to normal. So really, it's so important when you finish this conversation, you know, I want you to get vaccinated, but ultimately the choice is yours, and I'm here to help you and give you the good information so you can make the best tools for yourself. And lastly, like I said before, keeping those lines of communication open. Oftentimes these conversations take time. You have to have this conversation multiple times with the same patient, or they have to hear it from multiple different doctors as well. And it's really, really important every little bit. And you never know who you're finally going to reach. I had one patient last week who I was talking to, and I was sure they weren't going to get the vaccine, but I gave them my information. I gave them the resources, and they actually emailed me this morning and said that they're going to get their vaccine now. So you never know when you're going to plant the seed. So we have to take this time at every single visit. And then lastly, that access piece, helping them find that vaccine. Fortunately, the state has made it very easy for us right now, myturn.ca.gov, to help people find the vaccine in their local neighborhood. Next slide, please. Lastly, I think this is an important piece to say. When you say I don't know, it really builds trust. It really goes a long way to letting your patients know that you're not just making things up. Oftentimes, you know, I say this to my residents I work with: if you don't know the answer, don't make it up. Tell me I don't know the answer, but I'll find out and I'll get back to you. Now, not that some of the information we just don't have. Sometimes the data just isn't available, and if that's the case, say that. You know, science is on public display right now, and we're getting new information all the time, and that data isn't available. When we know, I'll reach out to you, I'll let you know. But if there's something you just personally don't know, let them know, and then try and follow up, try and find that information and follow up as well. You know, your audience will ultimately trust you more if you can admit that you don't necessarily know everything all the time, despite our desires sometimes. Next slide, please. So really here's the most important thing is whatever community that you are in, you know, how many people, there's 960 of us on this webinar right now. Wow, that's amazing. There's 960 individual communities that we are members of. So find your people, whether that's social, online, on Blogger, on video games, whatever your community is, friends, family, whatever membership or organization or association you are part of, or whatever community groups there are. Are you a member of the PTA, your place of worship, your fitness class? We are all now vaccine champions to go forth and be that trusted voice within our community and all of our communities, wherever that may be. Chances are we're all multiple parts of multiple different communities, and that's really the movement behind This Is Our Shot and Vacuna Teya, is to give all of our healthcare heroes, no matter where they are, the tools and the resources to hit the ground running locally in their community. Next slide, please.
Thank you so much, Dr. McDonald. Find your vaccine community indeed. And we are going to move on and hear more about the ask of you today from Dr. Tomas Aragon. Dr. Aragon?
Next slide, please. Okay, so here's the key thing that we're asking all of you to do today: to commit to talking to 30 patients in 30 days about the COVID-19 vaccine. We want you to become a champion of champions. Volunteer to host a training to educate your colleagues and community about effectively communicating about the COVID-19 vaccine. Click on the link in the chat to receive This Is Our Shot Weekly Hero Alerts, to receive the latest COVID-19 misinformation trends and conversation resources. Again, commit to talking to 30 patients, 30 clients, 30 whoever you think you can reach in the next 30 days. This is going to make, I understand there's over 900 people, so if we do the math, that's a lot of folks that we're going to be reaching, and that really becomes part of the social network that's going to get even more and more people vaccinated. So I want to just say, I encourage everybody again, thank you so much for taking time out of your day to listen to us and to take this opportunity to commit. Thank you.
Thank you so much. And we do appreciate you spending your precious lunchtime with us. We want to equip you with some resources, but we're going to launch our first poll in just a moment. So I'm going to read the question, and we realize we've given you a lot of information, and yet there are some nuggets we hope you've already been taking in, and we want to ask, following this training, how confident are you in your ability to talk with your patients and clients about COVID-19 vaccine? Very confident, confident, somewhat confident, slightly confident, or not confident. So we'll go ahead and launch that poll, and really let us know your honest answer about how confident are you in your ability to talk with your patients and clients, your community, about COVID-19 vaccines. This helps us, so your feedback is greatly appreciated. Again, take a moment, very confident, confident, somewhat confident, slightly confident, not confident, in the next few seconds while the poll is open. And we'll use this in our future planning for polls. So we do thank you for taking those moments to answer. And as Michael will finish closing up this poll momentarily, we will move on and we'll look at some resources available that we want to highlight. Again, first and foremost, to you right now in the chat, there are links to the slides, there are links to the campaign page, and resources available. Many of you have already asked, Leslie, where can I get the recording? It will be available, and I did put out to all that EasyIZ link, and it's also in the slide deck, so you'll be able to find that. But a great resources to direct unvaccinated Californians toward is MyTurn, and they can go to myturn.ca.gov. There's a live link there in this deck, or they can call 833-422-4255 to schedule their appointment. Next slide, please. And we have free trifold FAQ flyers. To request a free trifold brochure with frequently asked questions about COVID-19 vaccines, please visit easyiz.org/COVID/30 conversations. And you can click on that link that is available in the chat. There are general FAQ brochures in English and Spanish, and pediatric FAQ brochures in English and Spanish. Great tips and tools for frequently asked questions. Next slide, please. We also want to direct you to links at the bottom for Vaccinate All 58. We have This Is Our Shot, hashtag This Is Our Shot, and Vacunate Ya. I want you to please make use of these resources. They are amazing. So take a moment and check out those websites and find further information on how to navigate these conversations with patients. Next slide. So our next poll is asking, or making a statement really, I will commit to talking to 30 patients or clients in 30 days about COVID-19 vaccines. It's a yes or no. We'll bring that up right now. And Dr. Aragon gave that ask, and it's really a battle cry to reach our communities. How many of you will commit to talking to 30 patients or clients in 30 days about COVID-19 vaccine? And please note that by answering yes, you will be eligible to receive many other resources and emails coming your way. You'll opt into the hashtag This Is Our Shot, hero alerts with the latest information on COVID-19 vaccine misinformation trends, and conversation resources. So the poll will be open for just a few more seconds, and we want to make sure that we get your answer. That commitment can change the lives and the health and wellness of the communities that you serve. And we are grateful for those who are stepping up today and saying, yes, I will commit. It's really a battle cry for all of us. And as Michael finishes up and that poll will start to close, we're going to move toward our Q&A section. You've asked so many good questions throughout this webinar, and of course, pre-registration. So I'll pose the first question here, and this is asking our panelists, how do we debunk the conspiracy theories? Vaccines affecting fertility for both young men and women. So to our panelists, can you give a response?
Sure, I can give some comments there. Initially, when the vaccine first came out, the ACOG put out a statement, recommending the vaccine, but understanding that there was a lot of data left. Just last week, actually, the American College of Obstetrician and Gynecology put out a statement, basically a much stronger statement, saying they strongly recommend the vaccine for anyone who's may become pregnant, who's pregnant, or who's breastfeeding as well too. And they specifically said, let me read it so I don't misquote it. Claims linking the COVID vaccine to infertility are unfounded and have no scientific evidence supporting them. ACOG recommends vaccination for all eligible people who may consider future pregnancy. I don't know how much stronger a statement you can make than that. I think one thing too, when I'm in clinic talking to a patient who brings up these questions or brings up these concerns, one piece of information is, rather than just responding right away, if they tell you what their vaccine questions are, rather than just responding to it, asking them, can I give you my opinion? Can I give you my experience? And then usually they say yes. I haven't found anyone who says no, but some begrudgingly say no. But I think the key is to ask permission, and then when they say yes, it dissuades that kind of adversarial relationship, so that you're not telling them they're wrong. You're just simply telling them the information that you have as well.
Thank you, Dr. McDonald. And a question along the same lines as coming in about how do you stay patient and positive and listen to a patient and assure the patient that you respect their point of view, even though you may not agree with it. So how do you avoid appearing judgmental to your patients?
Go ahead, Dr. McDonald.
Oh, sure, thanks. It's really hard, honestly. And as the days go on, and the week goes on, it can be challenging, especially when their questions are more and more unfounded. I think just trying to take a step back and put yourself in their shoes. If your family, if your friends, if your social sphere is telling you one thing, you're more likely to believe it. And so try to take a breath, and again, know that you're not going to change their mind in that one conversation, and to make sure it's an iterative process and that you leave the door open. It can be very, very hard, I'm not going to lie, but sometimes taking a deep breath and knowing that, hey, I'm just going to give you my perspective, to sort of counter a lot of the other misinformation out there, and then let that seed germinate and grow, hopefully over time. I don't have a good answer, I'm sorry.
I think that is an honest answer, and we can certainly appreciate those challenges in communication. So thank you so much. There are many questions that have come through about the speed of vaccine development with the EUA, how to counter the argument the vaccine testing was rushed, we haven't given it long enough to see long-term results like with other vaccines. How do we approach that with our patients and our community?
That's a good question. I'll go ahead and start. In my experience is really primarily speaking to groups of people, and Dr. McDonald can really help you out with sort of the one-on-one conversation. And I think one thing there's sort of two ways to think about it. Is one way to think about it is that we have a tremendous amount of experience, because across the world, billions of people have been vaccinated. So we're, in terms of the amount of data, but it's also true that the amount of follow-up time after the vaccine is relatively short. And so I think we just have to be honest and acknowledge that. And so, for example, one of the areas that we're learning about right now is just about immunity waning from the vaccines. And so we don't know right now whether you're going to need a booster, because we're still collecting all that information. But one thing that is reassuring is that most people that do have adverse reactions to vaccines really have them within the first 2 months. And so what we do know is that many people are beyond that 2 months, and they're doing just fine. So, but we do have to acknowledge that the long term is not there, and we also have to acknowledge is that from the analyses that have been done, when you do the risk and benefits, the benefits of the vaccine far outweigh the risk compared to being infected with COVID. And we also do not know about the long-term effects of COVID. And so those are the things that we are preventing. So you have a much better bet with a vaccine than you have with COVID.
Thank you. And this actually relates to that, Dr. Aragon. How do we deal with people who feel they don't need the vaccine because I already had COVID?
Again, very great, very good question. And we do know that immediately after being infected, you do have some protection against reinfection. We don't know how long that immunity lasts. We do know that people who have had COVID and do get vaccinated have higher levels of protection based on the tests that are currently done to assess immunity after vaccine or infection. So your protection is definitely going to be higher by getting vaccinated, even if you've had COVID. Data is, as more data gets collected, and we have a better idea of how long immunity lasts in people who have been infected, and whether the type of infection they had is going to be predictive of lasting immunity, we don't have that information yet. So the safer bet for us is to get vaccinated, and we're also trying to have that population effect of reducing, getting that what we call the R effective, the reproductive number less than 1, because that's going to be our fastest path to getting back to a normal life is by getting that effective reproductive number less. And so we need more and more people vaccinated.
Great.
Dr. McDonald, did you have a response to that?
No, I think that's a great answer. I think one thing I always tell people too is that I got vaccinated, and sometimes I show them my vaccine card. And leading by example, we had this unique opportunity where healthcare workers could get vaccinated first before the general population. And I think that's such a valuable tool, is leading by example. Both you walk the walk and you talk the talk as well.
Great. Can either of you address hesitancy for the vaccine among Black Americans and Latinx communities?
I can start here, and
Yeah, go ahead.
excited to hear your thoughts too. I mean, this is part of the reason initially we started with this as our shot, and quickly realized that we needed a Spanish speaking version of our movement, because of our Spanish speaking population, something that's culturally sensitive, that's appropriate, language appropriate as well too. So I think really, again, this is why it's so valuable. I mean, I'm a white male, and I have patients who are Latinx and Spanish speaking, and I do the best I can, and I use an interpreter as much as possible, but it's not the same, and that's why it's really going to take all of us to really do this work. Physicians from the Black community are going to be much more valuable and important messengers than myself. So I think it's really about having physicians who look like you and who speak your language, who are from your culture, and even better, from your community, are going to be the most important messengers. And that's why it's going to take all hands on deck, all boots on the ground to really address people in their community.
Yeah, I want to just add that in your role as clinical providers, you are a trusted messenger, and so your role is so critically important. So that's one. The second one is going to be, and this is more on the public health side, is that you know, the way that we reach communities is through not just trusted providers, but trusted organizations in their community. So in my prior role, when I was a local health officer, we worked really we worked very closely with the faith-based community to reach the African American community. And it took a long time to develop those relationships and to build that trust around other topics. It's not necessarily about vaccines. It could be about food security. It could be about housing instability. It could be about intimate partner violence. It could be other ways that you build the trust. So don't be shy about reaching out to your local health department, because they've been thinking about this for a long time. So your local health department are your partners, and they might help you connect. They might help you, bring you along to, let's say, a church, and so they can get the clinical input as well as building that trust with the community. So I hope that helps.
Thank you. And we're seeing so many nice comments. Alice, thank you. We're so glad you are appreciating this information. And Gary added a comment saying, instead of using the word side effects, he uses response, the way people might respond to the vaccine. So lots of good knowledge amongst our audience today. And we thank you so much for sharing. We're going to try to get to another question or two before we end. In the past, we have said to people that let's see, the vaccine can keep you from getting sick, but with some new outbreaks with Delta around vaccinated people, can you give some language that that might be a little bit better than you won't get sick with the vaccine, or the vaccine can keep you safe from getting ill?
Why don't you take the first shot, Dr. McDonald?
I mean, I think what I tell patients is, you know, especially right now with Delta emerging, is the vaccine can't prevent all illness or COVID infections or transmissions for that matter, but it can significantly reduce the risks of severe disease, hospitalization, and death. I think keeping it very kind of straightforward and simple is very important.
Yeah, and I think that, and I really want to emphasize, I think for me that's really the bottom line, is is preventing severe illness and death is the most important thing, and it's not 100% of preventing infections. But if you do get infected, of course you might be able to transmit to other folks. So the public health folks are thinking about that. But I think in terms of getting them vaccinated, I think the most important reason I think is going to be the fact that they're protected against severe illness and death. And then some of the long-term complications that there's a lot of things that we don't know about that they're going to be protected from as well.
Thank you so much. And we are going to move on to our next slide. And we thank you for the many questions and answers from our subject matter experts. So we have one more ask. We appreciate your feedback on the following. Michael's going to launch this poll. I want to be a champion of champions by training at least one colleague on how to proactively communicate with patients and clients about COVID-19 vaccines. Yes or no? As that poll comes up, I want to be a champion of champions. And by wanting to, we realize that you may not have all the answers, but you're willing to dive a little deeper. And you're already doing that by attending today's webinar, by opening up these resources. The ACOG reference that Dr. McDonald gave us is in the chat. We've got some links to good resources. But yes, I want to be a champion of champions by training at least one colleague on how to speak with patients about COVID-19 vaccines. Please respond yes or no so we can hear from you. That's the greatest way. And as we are leaving that open for just a few more seconds, we are finishing up, but we want to provide you with a couple more slides. So we'll move forward in our slide deck. And we do appreciate your feedback. Special thanks today to Dr. Tomas Aragon and Dr. Alex McDonald, with content support from Dr. Atul Nakasi and Dr. Hussein Lalani. Webinar planning and support team, thank you so much for that pre-planning and behind the scenes work. We truly appreciate the time of our panelists today for their preparation. Really, thank you, Dr. Aragon and Dr. McDonald. It has been a good 45 minutes of great information. And we'll move on to our next slide. And most of all, we really want to thank you for your ongoing commitment to protect the health and well-being of all Californians and for joining us for today's webinar. And with that, we wish you well in your efforts as you continue to vaccinate California. Thank you for your time. We conclude.